I'm now going to demonstrate some hip flexion positional isometrics from a supine position. The intent of these exercises is to make the tissue largely in the front of the hip stronger when the hip is in a flexed or closed down position. The setup is very straightforward. I'm going to go onto my back and I'm going to pull a knee in toward the chest. If I am somebody with pain in the front of the hip, pain is going to limit my range of motion. I am not attempting to pull the knee in past a painful threshold. That is to say, if I can move my knee to this position like it is now, into hip flexion, and I do not feel a pinch in the hip, there is no pain, then this is a tolerable threshold. Alternatively, if I pull a little bit farther and I start to feel a pinching pain in the front of the hip, I'm going to back off only as far as I need to reduce that painful threshold. So saying this is my end range, one idea for a positional isometric will be to drive my palm into the knee as though I'm pushing my leg straight away from my body. I'm going to resist with the strongest but safest effort I can for 10 to 15 seconds of work. After I've done that, I'm going to change the vector of force slightly. So maybe I take my opposite hand with an angle slightly, maybe say 45 degrees away from my body, driving here, such that the knee is not coming straight up toward the chest, but slightly across the body. And I'm going to hold that resistance right here. 10 to 15 seconds of sustained work, highest, strongest, safest effort. Maybe I bring the other hand at an angle that way, drive the knee out against the hand, maintaining the strongest, safest effort possible, 15 seconds of work.